Good afternoon. Thank you everyone for joining us. As you all know, coronavirus is an ongoing epidemic and it's necessary to take precautions to minimize the risk of being sick and the transmission of the disease. Our medical director, Dr. Passi, is here to help us navigate the questions, concerns, and some of the misinformation surrounding the COVID-19 vaccine. Dr. Passi is a board certified in family medicine, sleep medicine, and medical acupuncture. He's been working with patients at Family Practice Center in Watsontown since 1999. Dr. Passi is here to clear up some of the vaccine hesitancy, address any questions you may have, which you can submit down at the bottom in the chat, and we'll try to get to those. And he's going to provide us with the information necessary about the vaccine in order to assist you with making the decision to get vaccinated. So, Dr. Passi, you can go ahead.
Thank you. Good afternoon, everyone. My name, as Leah said, is Vikas Passi, and I think it is no mystery to all of us how COVID-19 has affected all of our lives. It seems like it's lasted forever, but believe it or not, it started about 18 months ago. It's transformed our lives in terms of our economy, our daily lives, and certainly our patient care. I think we all know the basic statistics. There are about 32.3 million infections in the US that are documented. There may be many more that are undocumented. There are 575,000 deaths thus far, which yields a mortality rate of about 1.7%. More germane to our population, the vast majority of deaths are occurring in people 75, or I should say a significant minority, over 40% of the deaths are occurring in people 75 or older. And the mortality rate for that population is also very high. It is, okay, is that better, Leah? Okay, the mortality rate is very high in that population as well, up to 15%. It goes without saying it's had a huge impact on our patients' lives. I understand the vaccine hesitancy. One of the comments that I hear from my own staff, and I've heard at the nursing home, is, you know, vaccines and medicines take such a long time to develop. How come this was developed so quickly? Doesn't the speed of its development imply that there's an inherent danger? So let's talk just very briefly about how vaccines come to be and how medicines come to be. There's a R&D phase, and then the company will apply for a preclinical stage, a phase 1 trial, a phase 2 trial, and a phase 3 trial. So a phase 1 trial, the vaccine is tested on tens of people. In phase 2 trial, it's tested on hundreds of people. In a phase 3 trial, it's tested on thousands of people. And it is very true that medications and vaccines can take up to a decade to develop as they go through all these phases. The reason this vaccine was developed so quickly is because of a lot of the barriers that go along with that development were taken away. For instance, one of the barriers is cost. And the government funded both the manufacturing and the developmental costs upfront. So something a company may take a long time to raise money for, to invest for, to convince shareholders to invest in, that barrier was gone. What is important to remember is that the clinical trials were exactly the same as they would be for any other vaccine or drug. There was a phase 1, there was a phase 2, there was a phase 3, and there is, of course, post-marketing evaluation, as we saw with Johnson & Johnson, which, as we all know, had a bit of a pause. And let's take a moment to talk about that, because certainly that's raised some concerns. There were 8 million Johnson & Johnson vaccines administered. There were 15 total adverse events related to thrombosis. 7 of those were in women under the age of 50. The vast majority were in women between 30 and 39. There were 3 deaths. So the vast majority of the concern is in women under age 50. And the concern is a particular form of thrombosis that occurs with low platelets. And there were only 3 deaths out of the 8 million. To put that in some context, the lifetime risk of a death due to a car accident is 1 in 100. The lifetime risk of being struck by lightning is 1 in 15,000. So yes, it's a serious adverse event, but we should place it in some context. And looking at that context, as I think all of us know, the FDA has said that it's okay to go ahead and proceed. The other two vaccines, as far as I know, have not had an adverse event to that extent. The US has done a spectacular job in vaccinating people, probably the world's best, which is good because our incidence of infection and death rate was also among the highest in the world. And so what this is really going to come down to from this point on is really a tug of war between the vaccine and the virus. So the more people we get vaccinated, the less, obviously, the fewer number of deaths and illnesses we will have, but also the fewer numbers of the virus being transmitted from person to person. And that, of course, is important because as the virus is transmitted from person to person, it has the chance to change, to undergo a genetic change. The virus is under an evolutionary pressure to reproduce, to keep reproducing. And so the more transmissions we have, the more strains of virus we're going to get. And of course, the concern is that ultimately we're going to have a strain of virus to which the vaccine will be ineffective, and we unfortunately will be, back to square one. And I don't think any of us wants to go through what we've been through in the last 18 months. So there's a maxim that says, think globally and act locally. So the global picture is the more people we get vaccinated, the quicker we get past this disease and the less chance we give this virus a chance to win, to mutate to an extent that it defeats us. That's the global picture. The local picture is that while we are still in the process of vaccination, we have to take the precaution of at least the precaution of mask wearing and hand washing, because that also stops transmission. And we have to get vaccinated. I'd like to say that as the opening picture of the talk details, the somewhat non-gratifying picture, I put my money where my mouth is. I was among the first to get vaccinated, along with many of the staff at Watsontown, because I think this is the only way we beat this disease. This is a disease that kills many of the patients that we deal with on a daily basis at an inordinate level and at a very extraordinary rate. So our local action has to be that we prevent further transmission of this virus, so we save lives from the strain that's occurring right now, and that we prevent the virus from mutating and becoming more deadly. So with that, we'll entertain a discussion and questions.
Our first question is, who should get vaccinated?
Okay, so this is, at this point, anyone over the age of 16 is eligible for the Pfizer vaccine. Anyone over the age of 18 is, of course, eligible for the Moderna and Johnson & Johnson vaccine. So the short answer is everyone who falls into that category should get vaccinated. The longer answer is that there are obviously people who are higher risk, and there are people who are working in occupations where they pose a higher risk to others. So healthcare workers and people who have significant comorbidities. There are several identified comorbidities. Obesity is one of them, COPD, diabetes, among others. There's, we can go down the list, but those are the ones that, for instance, we use in our offices to stratify who gets the vaccine first.
Okay. You mentioned kids and young children. What is the age of youth that can get vaccinated?
So if the Pfizer vaccine is approved for 16 and over, I know that it's being studied for 12 to 15 right now. As far as I know, it has not been approved for that age group at this time.
Okay. Are young children susceptible to COVID-19, especially if a parent tests positive?
The short answer is they are susceptible. Fortunately, the death rate at 9 and under is virtually 0%. So it's frequently not deadly in that age group. What we are seeing with the latest spike is that there is a higher virulence in the younger population, but not thus far in children, so not under 18. If you look at the stratification of mortality rate, above the age of 80, it's something like 25%. Above the age of 75, it's about 15%. Once you get into the 50s, it's about 3%. And so one can guess, since the overall rate is about 1.7%, the younger you are, it's much less likely to be a deadly disease.
Okay. There's a lot of questions around pregnancy and pregnant women. So can pregnant women get the COVID-19 vaccine?
So far, there is not a specific recommendation.
Okay.
It is not per se contraindicated, but it is not indicated as yes, as far as I can interpret the literature. So I think this is going to have to be an individual decision with discussion with one's provider. There's no firm opinion yet.
Okay. Does that also apply to breastfeeding and trying to get pregnant as well?
So as far as breastfeed, so I will talk about my own interpretation of the literature here. Again, no firm guidelines. I am not withholding the vaccine from women who are breastfeeding because I don't see a mechanism of action where that's going to be a concern. I'm also not withholding the vaccine from women who are trying to get pregnant but not pregnant yet. Because they should have full immunity within 2 weeks, and beyond that, it really becomes a non-concern.
Okay. Is it okay for people in the same house to get different types of COVID-19 vaccine, or
Yes.
should they get the same?
No, they can get different vaccines. So far, there is no study that there's not been a cross study. In other words, there hasn't been a study that says, if you get the Pfizer vaccine as your first shot, can you get Moderna for the second and vice versa? That study does not exist right now. That would be a great study to have, but it doesn't exist right now. So right now, what they're saying is if you're doing Pfizer, stick with Pfizer. If you're doing Moderna, stick with Moderna, although they're both using the same technology.
Is there any differences that you can touch on from Moderna, Pfizer, Johnson & Johnson?
Yes. So I don't want to make this a college physiology lesson, but I'll try to point out some of the differences. So in terms of efficacy, the Moderna and Pfizer vaccines are virtually identical. They're well into the 90s. And if you look at the individual population sets that they use, they're absolutely identical. The Johnson & Johnson vaccine is a little bit less efficacious, but you really have to look at this in the context of vaccines in general. The efficacy of the Johnson & Johnson vaccine is good enough as compared to vaccines for other diseases. So, right now, the standard of care is any vaccine that you can get, you should get. And if you feel more comfortable in getting a single shot vaccine, that's what you should do. There should be no significant difference, specifically because in terms of prevention of severe disease, they're almost identical. Where there's a little bit of difference is incidence of disease, where Johnson & Johnson is not, quote unquote, as good. Okay, so that's the first part of it. The second part is the difference in sort of the technology of the two sets of vaccine. Moderna and Pfizer use a mRNA technology. So they take the mRNA of the virus, which is a kind of component, cellular instruction component that helps you make proteins, helps the cell make proteins, and inject it into the body. Our bodies then make the protein of the virus, and that's how we develop antibodies to the virus. The Johnson & Johnson uses a vector, uses a virus other than coronavirus to introduce that protein molecule into the body. So there's a little bit of a technical difference. If you want to get a little bit finer point to it, the mRNA technology is relatively new. It's not that it's not been tested, it's that it's relatively new as a vaccine. So those are the basic differences. And obviously the clinical difference is that Moderna is 2 shots a month apart. Pfizer is 2 shots, 21 days, and then J&J is 1 shot. So, if that's a consideration, that's something that one should consider. And then, of course, the specific warning that has been attached to J&J. So in my own practice, I do mention to women who are 30 to 39 in particular, of this risk. And if they feel more comfortable getting the Moderna, I certainly offer that. And in fact, in our practice, that is the vaccine that we are using.
Okay, great. Thank you. How long before the coronavirus takes effect? So if you're getting Pfizer or you're getting Moderna and you get that first shot, how long does it take to, cover you?
Okay, so this is a complicated question, which I will try to keep as simple as possible.
Okay.
The first shot, we think, confers about 70% immunity within 2 weeks. The second shot gets you up to 94% after 2 weeks. J&J full efficacy within after 2 weeks. So all of them, the number is 2 weeks, either after the first shot for the only shot for J&J, or after 2 shots for Pfizer and Moderna. Having said that, as you go along the process, you are at least partially protected. But the textbook answer right now is 2 weeks after the second shot.
Okay, great. So what's the difference between the first dose and the second dose?
There is no difference in, if you're asking me, what does the second dose accomplish? What the second dose accomplishes, it potentiates the first dose. So the way immunology works, the way the immune system works, you never generate full antibody response the first time you see something, your immune system sees something. It's also true, by the way, of allergies. It's very interesting. People say, well, I got exposed to this the first time and I was allergic. And I would say to them, that's not true. You've been exposed at least once before. The way the immune system works is that it's got to see something multiple times to generate a full response. So while there's no difference in the component of the vaccine, the difference is that the first time the body creates a memory, the second time the body acts on that memory and is able to sustain it. That's the way to look at it.
What are the most common side effects after getting the COVID-19 vaccine?
So I will tell you the ones I've seen, and I'll give you kind of a range, okay? So the most common side effect is a sore arm. That's what I've seen, and that's actually what the package insert says. The second most common thing can be best described as a flu-like illness. So, and that's the vast majority of people who have any effect at all. The most common true effect is nothing at all. Almost 85% of people don't see anything. Human nature being human nature, we only hear about the ones that do feel something. So, but really speaking, 85% of the people are going to feel like nothing happened. But of the responses I've seen, soreness of the arms, flu-like illness is by far the vast majority. I have seen some instances of dizziness. I've seen some instances of fever, and I've seen some instances of nausea. They are minority and easily treatable. I've treated them all as an outpatient. I've not had to hospitalize anyone because of a COVID-19 response. And we've given out, at this point, thousands of vaccines.
Okay. Just want to remind anyone, if they have other questions, they can please feel free to submit those to the chat. So what does someone do if they miss the window for their second dose?
Good question. So remember I said the idea here is to potentiate the response. It's to get the first response generates the capacity for memory. The second dose actually generates the memory. Think of it that way. So the time period is really a minimum. It's not a maximum. So if you miss the window, go to the next available shot and you will be fine.
Okay. And how long does vaccine immunity last? Are there booster shots?
Sure. So this is going to be an ongoing process. So here's what we can say. Right now for Pfizer and Moderna, and really for J&J, the answer is about 9 months because we have 9 months of data. The first phase 3 trials are about 9 months old now. So we can say with confidence it's going to be 9 months. Okay. Now, the way to think about this question is other disease states. So we all know the flu shot is every year, right? We have to potentiate that response because the virus changes. The thinking about coronaviruses is that coronaviruses relative to flu viruses are relatively stable. They don't tend to change that much. We hope that this is the case with COVID-19 as well. And so like a measles shot, it's going to last much longer than a flu shot, that sort of thing, because of the hopefully the stability of the virus, right? So It should therefore last at least 1 year. My hope in sort of thinking about the physiology of this is that it's going to last longer than that.
Now, earlier on, you touched on a few underlying conditions, and I know that concern of age and other health conditions are of concern for getting the COVID-19 vaccine, and one of them is immune disorder or immunocompromised people.
That's correct. That's correct. So here's how we are doing it in my practice. And believe me, we've tried to look at the literature as a practice and me as an individual provider to try to figure out where we shouldn't give the vaccine. So if you look at the package insert of the vaccine, what it says is that basically only if you've had an anaphylactic reaction to a component of the vaccine. Now that gets, of course, a little tricky because let's face it, this vaccine is relatively new, and how would you know? So the proper protocol, therefore, is to observe the patient for at least a half an hour. Most, if not all, anaphylactic reaction is going to occur within minutes. And so if you're observing someone for a half an hour or slightly longer, you should be out of that danger. And it goes without saying, if you have an anaphylactic reaction, that's the one instance where you should not get a second shot. There are some other broader guidelines that we are using within our practice. If you have had habitual anaphylactic reactions to other vaccines, plural, we are saying that perhaps you should not get the COVID-19 vaccine. Now, in terms of immune compromise, the interesting thing there is not that the vaccine is going to do you any harm; it's that it may be a wasted shot. You may not be able to generate enough of an antibody response. So we're telling people to stay off of steroids for a couple of weeks so that they have an appropriate response. Now, I want to say quickly here, I'm not suggesting that if you're on chronic steroid therapy, you stop it abruptly. Of course, this is a case-by-case basis. But let's say, you were going to get a steroid shot for a joint injection. We're telling you to hold off on that for a couple of weeks, as an example. Okay. If you're on a biologic agent for any of the common disease states, rheumatoid arthritis, psoriasis, psoriatic arthropathies, things of that nature, we're telling you to coordinate that with your specialist to see if those can be temporarily halted in the vaccine period. So we've had a couple of instances. So far, we have not had an instance where we've had to hold the vaccine entirely. We've just adjusted the other medications temporarily to make the vaccine more effective.
All right, thank you. And what about, we have diabetes. Are there any concerns in that area?
The only concern is you should get the vaccine because you're at a higher risk.
Okay. All right. Now, this is a question that comes up frequently. Are COVID-19 vaccines made with fetal cells?
They are not.
Okay, thank you. Is it okay to donate blood after getting the COVID-19 vaccine?
I know of no contraindication.
Okay. And can you get vaccinated if you're a recipient of an organ transplant?
So again, this is where it's not that the vaccine is going to do any harm. It's that if you're on suppressive therapies, is your immune response going to be such that the vaccine may not be as robust. So in the few instances, we have a few transplant patients in my practice, renal, liver, et cetera, and they're on Prograf or other anti-rejection drugs. The universal response from the specialists has been to give the vaccine. So there's no contraindication that I know of. But again, we take the trouble to talk to those specialists to see if the dosage can be adjusted or timing can be adjusted so that the vaccine has the maximum benefit.
Okay. Can the vaccine change a person's DNA?
Absolutely not. So let's just take a moment to talk about, I'm going to get into a little nitty gritty of how the vaccines work. So you are introducing a component, not the entire part, but a component of the genetic material of the virus to our body so it can produce antibodies against it. What the body does with that mRNA is destroy it after it makes the antibodies, by definition, because it's just made antibodies. So it goes and destroys that. So it is never incorporated into the nucleus. The mRNA never enters into the nucleus of any of our cells. That's not how this works. It always remains in the cytoplasm, in the periphery.
Okay, thank you. Can I get vaccinated against COVID-19 while I'm currently sick with COVID?
Okay, so this is again one of those questions that comes up often, and it's very important. So let's talk. We talked about contraindications. As you know, there have been some synthetic and human plasma antibody treatments for COVID-19. We do tell people, and the CDC recommends, that they wait 3 months if you've had antibody treatments specific for COVID-19. Okay, so that's one group that we should mention we do wait on. As far as people who themselves had the infection, we do not have a specific waiting period. Most of the recommendations are 2 weeks, but this is not set in literature. It's a best guess, best practices sort of scenario. And the rationale there is that you probably have a bit of an antibody response that's inherent, and you don't want to suppress the antibody response to the vaccine. So again, no harm. We just want the vaccine to be fully effective. Also, if you've gotten the antibody infusion, or the human plasma, again, no contraindication. We just want the antibody, the vaccine to work as robustly as it's intended to. So again, no contraindication. We usually 2 weeks post-infection and absolutely 90 days after antibody infusion.
Is there any data to reflect statistics of people who have tested positive for COVID after receiving the vaccine?
So if you're asking me, can you get COVID and test positive for COVID after being fully vaccinated? After the 2-week period, your risk is about 5% of your baseline risk. As we know, this is a very, very infectious, virulent virus. So, if you have no protection, your infectivity rate is almost 100%. That number goes down to 4 or 5%. And let's define what that means. That means definitive exposure within 6 feet of someone who has COVID and you're not wearing a mask, right? So in that subset of people, your risk goes from 100% down to 5%. If you're asking, is there any chance you can test positive because of the vaccine? The answer is no.
Okay.
The vaccine cannot give you the disease.
Thank you. If I have already had COVID-19 and recovered, do I still need to get vaccinated with a COVID-19 vaccine?
Absolutely. And let me explain a little bit. This is a question I often get, so let me explain why. So if you get any viral illness, you're going to have a temporary immunity. With COVID, we have used the number 90 days, but that's maximum. And that number is based on the number of people who test positive after becoming asymptomatic after having COVID. Okay, so that number is about 90 days. Beyond that, there are well-documented cases of people becoming infected again. So obviously, it's not a long-term native response is not a long-term response like it is in some diseases. Okay, so you should absolutely get vaccinated.
Should I stop taking my daily dose of aspirin before getting the COVID-19 vaccine?
There's no need to do that.
Okay. What should I do if I took pain medicine before getting the vaccine?
I'm not sure I understand it.
There was a lot of questions. A few staff members, CVS kind of told the staff, don't take anything after you've had the vaccine. But then it's also, what if aspirin is a part of their everyday regimen or Tylenol?
Okay, they, as far as I'm concerned, they can take aspirin and Tylenol. The only thing I would stay away from within a 2-week period would be steroids.
Okay. All right. Does anyone else have any questions for Dr. Passi at this time? I don't see any hands up. Thank you, Dr. Passi, so much for being with us today. We appreciate it.
Thank you very much for having me. Thank you for setting this up. And guys, if there are any other questions, if we want to do another one of these, if anybody wants to meet with me one-on-one with the facility, any employee, please let me know. I'm happy to answer these questions. We've been certainly having to deal with this for a while, and so I'm somewhat versed on it.
Thank you so much.
Absolutely.
All right. Have a great day, Dr. Passy.
Have a great day, everyone. Bye-bye now.
Bye-bye.